All right, it is officially final exam season, and you can just feel the pressure, can't you? You've been studying like crazy for weeks, and now it's all about pulling everything together. So think of this as our final high-yield cram session, designed to sharpen your focus so you can walk into that exam feeling totally unstoppable.
You have absolutely put in the work, so let's make it count. We are about to blitz through the must-know concepts, the ones that show up time and time again. And we're going to start with the heart.
So forget flipping through hundreds of textbook pages. We're cutting right through the noise. This is a rapid-fire review of the absolute heavy hitters, cardiac, respiratory, and all those tricky little facts that can make or break a question. Let's dive in.
First up, cardiac. You know it's going to be all over your exam, right? So let's make sure we have the fundamentals completely locked down, starting with the ECG waveform itself. Everything, and I mean everything, starts right here. This is your baseline. Think of it this way. The P wave, that's the atria giving a little squeeze. The QRS complex, the big spiky one, that's the powerful contraction of the ventricles. And the T wave is just the ventricles resetting for the next beat. Atria squeeze, ventricle squeeze, then everyone resets. Got it? Good. Okay, now look at how this table just simplifies everything. For bradycardia, yeah, it's slow. But your priority isn't the number, it's checking if your patient is dizzy or hypotensive. For tachycardia, the fast rate is just a symptom. Your job is to be a detective and find out why it's happening. But then you get to AFib. Notice how the game completely changes? Now you have two jobs at once. Control that chaotic rate and prevent a stroke. This right here is a massive, massive safety point. Stable angina is predictable, right? It happens with exertion, it goes away with rest. But unstable angina? That's when your patient says, you know what, this is different. The pain is new, it's happening while they're just sitting there, or it's lasting way longer. That, my friends, is a full-blown cardiac emergency.
You are gonna see this one for sure. This nitroglycerin protocol is a classic. Step 1, take a tablet. Easy. But the most critical step, the one they'll try to trick you on, is what happens if that pain is still there after 5 minutes. You don't just take another pill. Nope. You call 911. You get help on the way, then you can continue dosing. That specific order is what saves lives.
Okay, let's switch gears. Take a deep breath, literally. We're moving from the heart to the lungs. Section 2, critical respiratory concepts. You gotta love a good mnemonic. They save lives, and they definitely save exam scores. So when you get a question asking who is at risk for pneumonia, just run through this in your head. Is the patient post-op? Immobility is a huge risk. Do they have an NG tube? Well, that's a direct highway for aspiration. This mnemonic has got you covered.
And what if your patient gets pneumonia? What are you going to do? These are your top 3 moves right here. Get that head of the bed up to prevent aspiration. Push fluids like crazy to thin out all that gunk. And make them best friends with their incentive spirometer to pop open those collapsed little air sacs. Simple, but so effective.
Speaking of infections, let's nail down the tuberculosis meds. Just remember the word RIPE. It's that easy. R is for rifampin, and it turns body fluids red-orange. I is for isoniazid, which can injure nerves. P is for pyrazinamide, which is a pain for the liver. And E is for ethambutol, which can cause eye problems. You have to know these for your patient teaching and safety questions.
All right, you ready to shift gears? Welcome to the lightning round. These are the quick-hit, testable facts that you just have to have locked in your brain. Let's do this.
Just look at that number for a second. 0.8 to 2.0. I want you to burn this range into your memory because it represents one of the most dangerous narrow therapeutic windows in all of medicine. Any idea what it is?
That is the therapeutic window for digoxin. And as this slide says, it is razor thin. We're talking a tiny, tiny margin for error. If the level is too low, it's not working. If it's even a little too high, you are risking deadly arrhythmias. This is a pure safety question.
Diuretics. The classic showdown, right? Furosemide versus spironolactone. Just remember it this way. Furosemide makes you lose pretty much everything, especially potassium. That's a huge risk for hypokalemia. Spironolactone is the total opposite. It spares potassium, so you have to be on the lookout for hyperkalemia. The bottom line, always check that potassium level.
Now for a completely different but equally critical safety topic. When you're working with a victim of intimate partner violence, remember, Your role is not to tell them to leave. Your role is to help them create a safety plan for when they decide they are ready. These steps are practical, they're empowering, and they're exactly what you'd be tested on, especially that pre-packed bag with documents and cash.
For Meniere's disease, just remember this classic triad: vertigo, tinnitus, and hearing loss. Now, when a patient has one of those sudden, severe vertigo attacks, they literally can't stand up. So with all that going on, what is your #1 priority? It's not the ringing ears, it's not the hearing, it's safety. Period. This person is a massive fall risk.
Okay, we've covered a ton of specific facts. But what about that question that seems to come out of left field, the one you've never seen before? How do you answer that? Well, it all comes down to one single core principle for passing this test.
This is it. This is the golden rule of nursing exams. It doesn't matter what the clinical setting is. If a patient can't breathe, if their labs are critical, if they are having a seizure, that immediate physiological crisis is always your first priority. It comes before any psychosocial need every single time.
Look, it really is that simple. It all comes back to Maslow's hierarchy. It comes back to your ABCs: airway, breathing, circulation. You have to fix the body before you can even think about fixing anything else. In every question, ask yourself, what is going to kill my patient the fastest? If you follow that logic, you will find the right answer. Seriously, you've got this. You know the material. But this exam isn't just a test of what you've memorized. It's a test of your judgment. It's asking you to think like a nurse, to prioritize, to act, and to keep your patient safe. Go in there and show them the safe, competent, and compassionate nurse you are about to become. You're ready. Good luck.